Hey guys, today we're going to talk about osteoarthritis. Not a fun disease by any means, but there are some options out there for you if you happen to have it. It actually is the most common form of arthritis and something that is kind of changed over time. It used to be thought of as mainly an inflammatory issue, and things have started to change on that and progress with that. Risk factors for it are, first off, old age, people that are overweight, people that have had a joint injury, so old football injury, something like that at work. Also, from overuse of the joint, which can happen a lot in people that are lifting things on the job with your knees and your hip, in your wrist. If you're a typist or a computer worker on the keyboard, it can happen quite often with that. And then, of course, unfortunately, if you're female, it puts you at higher risk to get osteoarthritis. It's a progressive destruction of the cartilage that is naturally occurring within the joint. Unfortunately, there is no cure for it, and there's no treatment that will help stop the progression of the disease. However, there are some things that can help out along the way. The American Association of Rheumatology updated their guidelines back in 2019 to actually make some strong recommendations, as well as just standard recommendations, conditional recommendations, and strong recommendations against some of the things that we have been doing. First off, one of their strong recommendations are oral NSAIDs, or things like ibuprofen, naproxen, which is Aleve, meloxicam, for treatment to help with the osteoarthritis. However, as I've stated in previous videos, you do need to watch out. If you have kidney disease, this is not an option for you. If you have a family history or personal history of cardiovascular disease or risk, you absolutely want to talk to your doctor about before you start using those, because they can cause things like fluid overload and also alterations in your potassium labs as well. So you want to talk to your provider before you just start using things over the counter like ibuprofen or Aleve, because it can put you at greater risk. Also, people that are older in age can have issues with those drugs as well. Now, topical, the diclofenac or Voltaren gel, it is recommended in the knee and the wrist only, but not the hip. You don't get as good of results in the hip, but you can use it on your wrist and your knee and get some good results with that. Now, conditional recommendations that they've said. Tylenol has shown to have some results for a decrease in pain. So absolutely you can do that. And I've said in the past, you can also combine one extra strength Tylenol with two over-the-counter 200 milligram ibuprofen at the same time and get some added relief. In comparison, a couple of studies have shown that will result to the equivalent of one hydrocodone. So remember that you won't have the bad effects of hydrocodone as you do with just one extra strength Tylenol and two ibuprofen over the counter. Tramadol is conditionally recommended. Remember, you can see the dizziness, drowsiness. It is more addicting, but they also strongly recommend against any other opioids. So tramadol is the only one that's conditionally recommended. Duloxetine, or generic Cymbalta, which is an antidepressant, has a conditional recommendation as well. Remember, with that one, you'll want to taper up when you start on it. Start at either 20 or 30 milligrams. You can go as high as 60 milligrams. Dizziness, drowsiness is one of your main things that can affect you there negatively. Intra-articular injections. They're the last line of defense, I guess you could say, for that. They're strongly recommended in the hip and the knee with glucocorticoids. Those are strongly recommended. However, the hyaluronic acid that they used to recommend is now recommended against strongly. And the wrist, really, you don't see as good a results with that in the wrist, so they recommend against that as well. Now, something else that they have strongly recommended against is glucosamine chondroitin. I tend to disagree. I do disagree on this because one of the things that they've said is it doesn't show to have results. And that is true in 50% of the people. However, in 50% of my patients that I have used them on, you do need to use them for at least 2 months because a level has to build up in your system. After 2 months, 50% of the people that I've treated with it have shown results, and that's what studies have bore out as well. 50% will not see results. So if you give it two months of trying the glucosamine chondroitin and you're not seeing results, absolutely stop taking it. You're wasting your money. However, if you are seeing the results, continue to take it. It can cause stomach upset. Some people will see diarrhea with it. For the majority of the people, there will not be any problems with adverse reactions. Very few drug interactions as well. I recommend the triple strength. That's the highest you can get. Double strength is also a little bit more affordable, and you should see some results with that. Again, 50% will see the results in 2 months. 50 won't if you don't get away with it or quit taking it. The best things that you can do, number 1, lose weight. Number 2, exercise. Number 3, something like Tai Chi. Anything that will stretch out your joints and your muscles will help, because as you limit your ability to stretch things out, you're limiting your movement ability in those joints. So even doing stretching before your exercise or before you go to work can help with the osteoarthritis to overcome the limited motion that you will have. Another good idea is to see a physical therapist or an occupational therapist. They can go through some mild weight training with you as well as exercises that will help increase your range of motion.